Another class of high alert medications in the community, fairly generally, I've listed some examples here on this slide, but anti-epileptic drugs or medications that are used to treat seizure disorders. They're all very different. So there's multiple different classes of drug. Each one of these classes of drugs has their own nuances. And many of them do have a lot of potential severe side effects. And many of them are considered to be narrow therapeutic index. And for those of you that haven't gotten to that portion of the course yet, a narrow therapeutic index drug is a drug where there is not much difference between a dose or a concentration that is therapeutic, meaning one that's going to adequately treat the condition without an excessive risk of side effects, and a dose that's either subtherapeutic, meaning it's not enough to control or treat the underlying condition, or a dose that's supratherapeutic, meaning that it's a dose that's going to have an excessive risk of significant side effects. So when you talk about a drug that's used to treat seizures, you really have a strong consideration there, because if the patient doesn't get enough, they're going to be at risk to experience seizures related to their disorder. And if they get a little too much, they might be at risk for some of these significant side effects that come with these medications, which can range from electrolyte disturbances to kidney toxicity or other organ toxicity or damage, and significant neurologic adverse events. So these all need to be handled with care. There's some consideration that goes into determining whether or not it's appropriate to interchange generic products for brand products in these classes, or one generic manufacturer to another, because while we generally recognize that as something that's safe and equivalent for patients, for narrow therapeutic index medications, there's a little deviation that's allowed for those generic products, and that little deviation can make a significant difference in the patient outcome with a narrow therapeutic index drug. So just a lot to consider there. So these patients definitely deserve extra care. And as a pharmacy technician, you need to make extra care in terms of, verifying the correct details of the prescription order, and making sure the patient, is receiving a consistent product and is aware if something has changed from their last fill.